So the article I chose was the effectiveness of a psychological support program for relatives of people with mental disorders compared to a control group. It's a randomized controlled trial by Rocio, Carmel, and Enrique. So a little background. The prevalence rates of severe mental disorder, it ranges from about 2 to 7%, where schizophrenia represents 1%, bipolar at 2, addictions at 5 to 7, and severe depression from 4 to 6. Excuse me. These patients are characterized by substantial declines in cognition, mood, perception, behavior, and judgments. Because relatives are oftentimes the caregivers of these patients, they usually suffer directly the negative effects due to addressing the range of stressful events brought on by the illness. These usually include dealing with psychiatric symptoms, changes in quality of relationship, disagreements, lack of support, and financial strains. They may also experience high levels of burden and mental health problems. So an estimated 15 to 66% have a significant level of depression. So because most programs that are already in place are more focused on the well-being of the patient, there is, I guess, more of a need for programs that provide support to the relatives as caregivers. And this leads us to the purpose of the current study, which was to assess the effectiveness of a psychological intervention. It was designed specifically for relatives of people with severe mental disorders, and it focused on their well-being and emotional needs. So the design utilized had randomized control trials that used a 2-group experimental design with repeated measures. The randomization was achieved by the order of arrival of the participants, matching them by gender, age, and then family illness. So the sample was obviously a convenience sample composed of 50 individuals seeking psychological support who had responded to a call for volunteers. In the end, there were about 30 were placed in the experimental group who were assessed at pre-treatment, post-treatment, and then at the 6-month follow-up, while the remaining 20 were placed in the control and were assessed at baseline and then 6 months later without any intervention. So the inclusion criteria involved 18 or older, living with a person with severe mental health problems. So in this case, it would be psychotic disorders, bipolar, severe depression, and addictive disorders. They had no history of severe mental health problems, not currently undergoing psychological treatment, and there was a provision of informed consent. So the sample characteristics of patients, this ended up being 80% female. There is an average age of 44 years, where most of the cases included them being married or having a partner in the house. 38 were parents, 18% were sisters or brothers, 32% were sons or daughters of the patients. Their relatives ended with the following characteristics. So 54% ended up making up psychotic disorders, where 20% were bipolar and 12% had addictions. The measures they looked at included the Symptom Checklist 90 Revised, which involves a Likert scale that assesses symptoms. There was the State Trait Anxiety Inventory, which is used to distinguish anxiety from depression. There was the Beck Depression Inventory 2 Maladjustment Scale, and that was used to measure intensity of depression. And then the Stress Coping Questionnaire obviously evaluated coping, but it looked at the 7 different styles and placed you into one of those categories. Then finally there was a Rosenberg Self-Esteem, which was designed to measure self-esteem. So treatment consisted of 10 weekly individual sessions of 1 hour duration. There was a psychological support program which was designed based off of a cognitive behavioral approach that emphasizes the learning ability of people to cope with stressful life events. This is based on a handbook and was delivered personally by the first author of the study to all participants. All participants were also provided with workbooks to use during sessions, and homework tasks were assigned between sessions. So currently the main objective was to help families understand the relative's mental disorder, provide them with tools to manage their discomfort and strategies to improve their relationship with the ill family member, and provide them with effective coping strategies to use in the face of stress. So each intervention was specifically tailored to the features of each participant's background. Okay. So the procedure was carried out at the Unit of Clinical Psychology of Basque Country University and approved by the university's ethics committee. The experimental group, like previously said, was assessed at pre-treatment, post-treatment, and then a 6-month follow-up, while the control group was assessed just at baseline and after a period of 6 months, without treatment. This was done in order to check whether the passing of time had generated any changes in measures. So we have data analysis, and this was conducted using SPSS 20. The data was analyzed using descriptive statistics, means and standard deviation for the quantitative variables, and then frequencies and percentages were used for the qualitative variables. The Kolmogorov-Smirnov test was used to compare the two groups, which checked for the normality assumption. Results obtained yield that it was not met in many areas. Therefore, an analysis of covariance, also known as ANOVA test, were used with pretest variables as covariates. The partial eta squared was also calculated in order to estimate the magnitude of difference between groups and the effect size of the intervention. Results. The results of the treatment and the between-group analysis showed that the effectiveness of psychological support program obtained by comparing scores at 6-month follow-up showed there was a statistically significant difference with considerable size effect as seen on the SCL90R. So pre-treatment ranked nearly all participants in the 90th percentile, where results show that the experimental group ended at 30, while the control group remained at the same level. So when looking at the psychopathological variables, improvement in those treated was statistically significant with large effect sizes in all measures. The depressive symptoms of experimental depression reduced from mild to sickness absence, and then anxiety level reduced from the 85th percentile to the 5th. Level of maladjustment improved at levels below cutoff point. So, treated subjects increased strategies, more focused on finding solutions, more proactivity, and they showed a decrease of negative self-targeting and more adaptive re-evaluating situations, and an increase in social support networks. They also had reduced levels of emotional expression and levels of anger and criticism. Almost all measures showed moderate to large effect size. So with limitations there was a high ratio of women to men. This could represent the notion that women have the burden of caregiving fall onto them more often, or it may be a product of the fact that women are more active in seeking treatment. An increase in sample size and longer follow-up period would be required to obtain more conclusive results. Another problem is that more than half of the family members had university-level education, so it would be appropriate to study relatives belonging to all educational levels. This would allow for increased variability as well as assist in upping the generalability. And then also, this study doesn't carry out blind ratings of outcomes.